Coronavirus cases stands at 363, following the announcement of 8 new cases. Another 8 people have been discharged after testing negative, raising the number of recoveries in the country so far to 114. No lives have been lost in the last 9 days. Health Cabinet Secretary Kagwe has outlined measures that restaurants will have to comply with before getting the green light to reopen, but it appears the measures are applicable to high-end restaurants. We begin tonight with KTN senior reporter Rita Tinina.
We now in this country have some 363 positive cases in Kenya, having today confirmed some 8 new cases.
Of the 8 cases, 3 were picked from Nairobi, 4 from Vita in Mombasa, and 1 from Kwale.
We have now also discharged some 8 people today, bringing the total of those who have recovered to 114.
And in the first move to ease stringent COVID-19 containment measures, some restaurants and eateries will be allowed to reopen, but against a tough checklist. For starters, employees will have to be tested for COVID-19.
If your persons have not been tested, you cannot open a restaurant.
With a test costing a minimum of 10,000 shillings at select private facilities like the Nairobi Hospital, the requirement may lock out ordinary urban restaurants. To illustrate this, a restaurant with 50 employees will spend 500,000 shillings on COVID-19 tests. Restaurants may be further disadvantaged by space requirements. They will be required to limit the number of customers to 4 people for every 10 square meters, place tables 1.5 meters apart, and maintain a physical distance of 1 meter in food preparation areas.
There will be no buffet, as we understand it, or self-serving food and people walking around and, in the food areas.
Restaurants will operate between 5 a.m. and 4 p.m. and have to measure the body temperature of all customers.
This is not a license to start opening pubs. It is not a license to start opening alcohol sale across the country. Alcohol shall only be sold with those having meals in a normal manner in a restaurant.
The measures were announced as Kagwe inaugurated the advisory committee on the supply and utilization of blood. The country has been facing a blood crisis after funding from the President's Emergency Plan for AIDS Relief, PEPFAR, a U.S. government initiative, came to an end. The program had been funding blood safety programs, including infrastructure, blood collection, and blood testing. The country needs 1 million units of blood per year. Last year, the National Blood Transfusion Center collected only 164,000 units.
We need to address this issue with the utmost seriousness that we can garner.
Many will be hoping that the newly inaugurated committee will give a shot in the arm to blood transfusion services and ensure Kenya's blood banks are refilled. Rita Tinina, KTN News.
The Big Q.